How does Auramine-Rhodamine staining diagnose TB? Imagine trying to find tiny bacteria hidden in a sample of mucus. Auramine-Rhodamine staining helps scientists spot the tuberculosis bacteria quickly and clearly. This method uses special fluorescent dyes, Auramine O and Rhodamine B, which stick tightly to the cell walls of the bacteria. These bacteria have a lot of mycolic acids in their walls, and these dyes bind specifically to those acids. When viewed under a fluorescence microscope, the bacteria glow bright yellow, orange, or reddish yellow against a dark background. This glow makes it much easier to see the bacteria compared to traditional methods. The process begins with preparing the sputum sample by fixing it onto a slide. Then, the slide is stained with the Auramine-Rhodamine dye mixture. After staining, the slide is washed to remove excess dye and then treated with a decolorizing solution. This step helps reduce background fluorescence and removes any nonspecific staining. A counterstain is then applied to improve contrast. When the slide is examined under a fluorescence microscope, the tuberculosis bacteria appear as brightly fluorescent rods. Non-acid fast bacteria and debris do not fluoresce, so they stay dull or pale, making the TB bacteria stand out clearly. This technique is more sensitive and faster than the older Ziehl-Neelsen stain, which uses a different dye and light microscopy. Because Auramine-Rhodamine staining can detect fewer bacteria, it is especially useful for early detection of tuberculosis. It allows health workers to identify infected individuals more quickly, which is crucial for controlling the spread of the disease. However, because it is slightly less specific than Ziehl-Neelsen, positive results are often confirmed with additional tests like culture or molecular methods. In the broader context of tuberculosis diagnosis, Auramine-Rhodamine staining is a valuable tool in sputum smear testing. It provides a rapid and reliable way to identify acid-fast bacilli, helping clinicians decide on treatment sooner. This method is widely used in laboratories around the world, especially in areas with high TB prevalence, to support early diagnosis and treatment. Remember, if you or someone you know is being tested for tuberculosis, it's important to follow up with healthcare professionals for confirmatory testing and appropriate care.